Let's talk about testosterone replacement in women and pellet therapy versus topical testosterone replacement therapy. Here are some key points. A lot of people in the medical industry are gonna poo-poo pellets. These are people who have not actually prescribed, used them long enough themselves. It's just a confirmation bias being handed down again and again. So as someone who's done both, not one or the other, I am well equipped to tell you that the constant feedback, which is pellets don't absorb in a predictable manner. They're all over the place, but topicals are more predictable. This is not true in real life. I have a very, very large sample size of patients over almost a decade, and after doing both, and a lot of my patients are aware of this, I am checking these labs at least 3 to 4 times a year for both types of patients. Guess what? Here's the truth. Both items have unpredictable absorption when you're looking at and measuring serum levels. Okay, not one is worse than the other. I have had patients who were on pellets transition to topicals, absorb the topicals a lot more than even the pellets, which was not what someone would expect to tell you. More side effects were seen in the patients who were doing estradiol patches than even estradiol pellets or testosterone. I've had some who overabsorbed a topical cream at a low normal starting dose, much higher than the testosterone pellet. There are side effects no matter what. In all of this world, there has to be the knowledge of management, predictability, and experience. So the ultimate message here for me is no, it's not about just pellets don't absorb in a manner that we cannot predict. Topicals do the same, and I have seen it again and again with FDA-approved drugs as well as compounded topicals. They are all pretty variable. The other final message here is that a lot of on the emphasis being symptom control, not looking at lab values, stems from the foundation that absorption varies, like I've been saying, but that does not correlate with symptomology. So one female's estradiol on that same dose of a patch could look incredibly low. Another female's could look incredibly high. It's not certainly predictable, it's incredibly individualized. The message here is that the right modality needs to be individualized for the right patient with the right knowledge and follow-up. Okay, do not demonize any specific modality for any patient in terms of compounding prescriptions, in terms of pellets versus whatever limitation there currently is because of the stock problem that there's already happening, right? So the more tools in your toolbox, the more experience, the more you can take care of people the correct way.